What's today all about, Michelle?
So today we're gathered to speak out about public health care. We're here with the Ontario Health Coalition, local unions and community groups, local citizens, talking about the underfunding of public health care. As you saw yesterday, there was an announcement from Ross Romano, but it's only a temporary announcement. It's interesting that they're putting $1 billion to put beer in corner stores, but they only came up with $2.8 million to put into healthcare as a temporary solution. So these people will be with nurse practitioners, which was already available at group health. So it'll be interesting to see how it rolls out, but let's hope it at least helps those people stay out of the ER.
So obviously this group here feels like it's in plain sight that the long-term plan of the province is to privatize.
I mean, we're aware of that, right? I mean, this was a 2-year plan, and if you look, when is the next election? Exactly in 2 years. Is this going to get implemented and be something that goes forward? Yes, they're saying that they're going to hire doctors and this is just a stopgap. Well, let's hope that it is. Let's hope that this actually gets put in place and we get doctors coming to Sault Ste. Marie, but I think the announcement was certainly timely.
And, you know, philosophically, from your group's point of view, protesting to protect is never a bad thing.
No, and we see that, right? We see under pressure is when the government comes to do things. And so here we are standing here. We had 300 people at the last rally at his office, at Ross Romano's office, and now here we are together again today. And you're seeing more folks out here frustrated what's happening in public health care. We need to keep public health care public. People should not be paying to go to a clinic or paying for service. I just heard yesterday that it's $3,000 up to between $3,000 and $30,000 for people to access mental health and addictions care. I mean, how is that a service that's not covered under OHIP? So, I mean, we need to stand together and have our voices heard, and we need to be loud so that they understand that we're here, and we're here to make a noise, and we're here to get service and keep public health care and public services public.
And this is a province-wide one. Toronto obviously is going to be large, and some of the other cities involved were...
So there's across the north, there's Toronto, there's Thunder Bay, Kenora, Sault Ste. Marie, and obviously, I mean, people here, it's too far to travel to Toronto, so that's why the situation. I believe there's one in Ottawa as well. So the expectation is that we would get the conversation out to 500,000 people across the province. There's signs to be distributed, petitions to be signed, and we're hoping that people will step up and be part of the conversation.
We have been doing that for over a decade, since about 2008-ish, when we did spend to the national provincial average. And since then, it's been falling off. And now we're at the bottom of the heap in Canada. Yay! And by a lot, and I'll come back to that. But what did Doug do when he wanted to get elected? At his convention, where he was running for premier, running for the leadership, cabinet minister, or at least potentially they were in opposition then, but they all went up to the microphone on television and said, we're going to get rid of this tax and spend liberal government. That's what they said. But what they weren't telling you, and it wasn't getting picked up by the press at the time either, but what they weren't telling you was that Ontario was at the bottom of provincial spending on all programs. So this government wasn't a big spender, quite the contrary. That remains the case, unfortunately. And we see the result in our hospitals. The Sault Hospital right now is reporting that they don't know how they're going to balance the books. Because they can't. Because they got a 0.5% increase in their budget this year, like the rest of hospitals in Ontario. Many of which are closing emergency rooms or other departments, some of which are closing completely. We lost the Thessalon Hospital here on the North Shore last year for a couple of days, and almost Blind River, and there's threats to more to come, but there's been over 800 emergency room closures in the last year, unprecedented, okay? So we're really underspending on healthcare in Ontario, contrary to what a lot of people might think. But these are borne out by the government's own numbers. The Fiscal Accountability Office points out that we spend about $15 billion less than our peers. $15 billion. But our heroes came to the rescue yesterday. Many of you in this room will know. Right? Our hero, Ross, and the minister, they said, well, we've been working so hard over the last months to come up with a solution to the group health center crisis, where 10,000 seniors were derostered in January. That's 4 months ago, right? So we're happy that there's a kind of a solution here. At least those people who have been waiting, many of them with precarious health, right, for months to know where they were going to be able to get their primary health care, because it was going away for them. The records and all, they wouldn't have had access to the group health center at all. So he comes up with $2.8 million. Okay, now let's put that in perspective. $15 billion is missing from Ontario spending on health care, and he comes up after 4 months. After 4 months, he comes up with $2.8 million. Bravo, Ross. $15 billion. $15 billion is 15,000 million. Now, I guess you know that, but you've got to remember that when you put these numbers side by side. So Ontario has the resources to fix its healthcare problems, but it's choosing not to. And you might ask, well, why be that crazy? Well, it's because it's the plan, right? You defund the public system to the point where you make people vulnerable, and then you can sell them the snake oil of privatization, because that's what it is. We don't need it. We have space in our hospitals. We have space in our hospitals. Operating rooms, not so much on the wards. They're packed, they're jam-packed. They're over capacity. But our operating rooms have capacity to do these surgeries that he says he needs the private clinics to do. Well, we don't need private clinics to do those surgeries. We need to fund the staff to keep the ORs open, to do them in the public place. And to continue to do that. The answer is greed. That's the reason for this, right? Private greed over the public interest. So we're here today to defend the public interest, and I'm going to let a couple of other people take up the task of explaining why that needs to be done. So I'll invite my first colleague up there, Bernie Thorpe. Bernie, come on.
That's right.